talk about primary prevention, in which about taking measures to just combat that kind of risk factors that can develop a bad behavior. Um, there are going to be different strategies for that. Strategy number one is just the primary one, and I would say it is very popular. It is like getting help directly from doctors or getting help directly from someone that would just help you to stop developing a bad behavior. For example, if you gained some weight and you want to just lose that weight, you're going to go for a personal trainer who could just help you just lose some weight. There's going to be another strategy. This is actually like some sort of focus group that, for example, if you have like a smoking habit and you want to just get rid of that, you're going to go to a focus group or a program that could just help you to just stop that bad behavior. However, changing health behaviors gonna be like something very related, very close to demographic factors. Age, sex, values, personal control, they are just very important. Why age is important? Because as you are younger, you would have like that kind of crazy behaviors, right? You're gonna smoke, you're gonna drink. I would say that is fine, but you shouldn't do that so much. It just up to a point. But the point is, as you are getting older, it's just very hard to just quit those bad habits, right? For example, if you are drinking 5 cups of alcohol, like wines, like every day, and you are like doing that every day for like 40 years, it's just very hard to just quit that when you are 60, right? So as you're getting older, it's just very hard to just kill those habits. Sex is important too. It seems like males, they are just have a tendency for just having some sort of crazy bad behaviors. Values, it is very important because from culture to another one, some habits, they are like less or more. For example, in my culture, like we are just very careful about not having like extra sodium in our food. Or another one gonna be, for example, I personally wouldn't drink much because like the household that I was growing up, they were not that much like drinking alcohol every day, every night. So I actually picked that habit, like having like a decent amount of different drinks, even soda, weekly, not very much. Personal control is very important too, because some people they do have a great like personal control level. Some others they are not. For example, they actually looking at other people around them to just make them stop, right? For example, you are looking at your parent to just ask you to stop, or you have a partner that you are just looking up to them and just seeing that if they are drinking, you're gonna drink, or vice versa. So personal control is very important. It should be from you. It shouldn't be from anyone, I would say, close to you, because it's gonna bring other problems. But yeah, based on personal control, we do have a scale which gonna be health locus of control scale. It is actually the degree that you're gonna feel like either you are in charge of a health behavior or someone else is actually pushing you for that. For example, if you do have a physician or if you do have a doctor that actually pushing you to just stop sugar intaking, or like a doctor that actually like constantly just telling you that, hey, you're just having a lot of sugar or sodium in your food, maybe you should stop that. It's going to be something from other people. So your health locus of control scale, it's going to be different from someone who actually not consuming much sodium or sugar because they are just wanted to do so. It's not about anyone else out there, it's just about themselves. They do have high personal control. So, factors responsible for practicing and changing health behaviors, social influence. Previously, I used to say that social influence comes from your friends group, which is correct, but nowadays it's actually coming from social media as well. For example, we can just see that there are some people they do have a good healthy habits. So if we would follow them, it is good for us too. You are seeing someone and just posting some workout every day, so or like yoga practice, right? So you feel like why not me? So you're gonna pick up that habit. Or you can see that people are just having good diet. They are actually caring about themselves. I personally, I just look up for that kind of, let's say, healthy diet, like full of vegetable instead of meat nowadays. I wouldn't say I stopped eating meat because like I'm not that much strong yet. But I'm just looking for different recipes to actually have that kind of nutrition in my food. Also, just, I'm not a big fan of eating meat, to be honest. I feel like it's not really good for the environment, it's not good for animals, it's not good for my body. So, social influence is very important. That actually leads to personal goals and values. If you do have like some personal goals and values, definitely it's gonna actually impact your health behaviors. I know that I can speak about my people. In my country, Iran, we don't eat pork at all because of our cultural values. However, I know that like people in other cultures, they don't mind it, which is good for them. But the point is, this is based on my values. So I might actually have, let's say, less sodium intake because I'm having less pork, and it's been, I mean, based on the research, pork has a lot of sodium and all that. Or I know that some parts of India, they are Hindu, and Hindu, they are not eating meat at all, which is again good for them because like having vegetable most of the time, it's going to bring you a lot of nutrition. So personal goals and values is very important for health behaviors. Access to the healthcare delivery system, of course, is very important as well. Knowledge and cognition, it is very important too. Whenever you are reading more, you are curious about your own body, you are just trying to identify yourself either mentally or physically. For example, if you would know that you need to work on your mental health as well, and you are reading that, you are reading constantly to just improve yourself, it definitely can help you a lot to just be stronger and change bad habits better, right? More effectively. There are some barriers to modify bad behaviors. There are going to be some emotional factors that can actually impact your body, which can actually bring some sort of unhealthy behaviors. Let me give you an example. For example, if you are depressed or anxious or stressed, right? I'm telling you, you're gonna consume a lot of junk food because you are stressed. Whenever you are having exam, you don't care about what you eat, which is not a good idea. You always need to actually care about that part. I personally, I used to be like that. I still, yeah, I'm doing that from time to time. But one way that I'm actually trying to stop myself is doing meal prep. Like I'm just whenever I know that, for example, next week gonna be hectic, I would just do meal prep. I put it in my fridge because I know I would just eat a lot. So the only way to stop myself from eating junk food, it's gonna be eating my meal prep, which gonna be soup or vegetable or something like that. Another one gonna be instability of health behaviors, which actually says that, for example, you're gonna do running for 2 days, then you're gonna just quit, right? Or you're gonna have like some sort of healthy habits, then you're gonna stop. So you shouldn't be in a stable, you have to be consistent. They are just very important as well.